September is World Alzheimer's Month, and Dr. Bredesen is the author of the End of Alzheimer's program, is joining us today to talk about a few myths surrounding this disease. Good morning, doctor. Thank you for joining us.
Thanks very much for having me.
Well, September is World Alzheimer's Month, but what would you say would be the top #1 myth that individuals have when they're thinking about Alzheimer's?
Yeah, that this is a disease of old age. You know, we used to think of this as a disease of your 60s, 70s, 80s, but it turns out that you actually begin the biochemical changes about 20 years before a diagnosis. So this is really a disease of your 40s, 50s, and 60s, and even into your 30s sometimes. And so it's important to remember this isn't something that happens to you when you get really old. This is something that's happening to you during your midlife and even again into your 30s.
Well, let's talk about the thought process or even the myth that it's hereditary or it's something that is genetically passed down from one generation to the next.
Right, so about 5% of Alzheimer's is so-called familial Alzheimer's disease, and where it really tracks generation to generation. But 95% of the time, it is so-called sporadic. So you can inherit an increased likelihood of it, but it's not your fate. So for the vast majority of us, this is related to exposures we have, infections we have, hypertension, dozens and dozens of different characteristics, some of which are similar to what increases our risk in the pandemic for a poor outcome. And it's important to put this in perspective, that the Alzheimer's will kill about 100 times as many Americans, of the currently living Americans, as the pandemic has. So this is really a much larger pandemic and something we should all be aware of. It's far too common of a disease, and in fact, if we all do the right things, we can make it a much less common disease.
Well, let's talk about some of those things that individuals can do as far as treatment options if they're diagnosed with Alzheimer's.
It's a great point, and the main thing is, please don't wait. What we call Alzheimer's disease is really the fourth stage, the end stage of this 20-year process. So we really don't want to wait, and we recommend that anyone who is 45 years of age or older, just as we all know, when we turn 50, what do? We get a colonoscopy. Then we should get a cognoscopy if we are 45 years of age or older. And this will look at a number of different blood tests. This will look at specific online cognitive assessment. And then if you're already having symptoms, you want to have an MRI with volumetrics. So you're actually looking at the volumes of specific nuclei within the brain. So getting on active prevention or early reversal, and especially if there's any family history of dementia, very, very important. And so first looking at those, and then second, addressing the things that actually contribute to cognitive decline. And those include 7 key things: diet, exercise, sleep, stress, brain training, detoxification, and then some targeted supplements for everybody. So there are various things that people can do to reduce their risk for Alzheimer's disease.
Well, doctor, let's talk about your book, The End of Alzheimer's program. Where can individuals get a hold of that resource to be able to take a deeper dive into some of the myth busters that we talked about this morning?
Absolutely, and anywhere books are sold, so Amazon, Barnes & Noble, places like that, you can get this book.
Well, doctor, thanks so much for joining us here this morning on Hometown Living to share about this resource, as well as some things that individuals can do to possibly help their risk factors for Alzheimer's. Thanks for joining us this morning.
Thank you for having me on.
For more information, you can visit cognitivehealthcenters.com. Well, coming up, it's time for stars to hit the red carpet.